Hi, my name is Sydney, and this is my audience, Kaylee, Alyssa, and Rob. Let's just get right into it. Alright, so according to research done by HRF, over 1 million Americans, or 0.5% of the adult population, has used steroids, and these steroid users are subjecting themselves to over 50 different side effects that have a wide range of severity. So my goal today is just to educate you on what steroids are and the potential outcomes of using steroids. I'm going to discuss the history of steroids, the two major types that fall into the two main categories, and then the positive and negative health risks. I'm going to begin by talking about the history and the major types. So according to CSER, the Center of Substance Abuse Research, steroids can be traced back to the 1930s, where the term steroid wasn't even used yet. A team of scientists created a synthetic form of the male hormone testosterone, which was used to treat men who didn't produce enough of that hormone for regular growth. And then steroids were later used in World War II to help treat soldiers who were malnourished and needed to gain weight. And they also used it to make the soldiers more aggressive. In 1988, there was a major federal regulation of steroids due to the Anti-Drug Abuse Act due to athletes starting to use the steroids. And by 1990, there were certain anabolic steroids that were classified as Schedule 3 on the Controlled Substance Act, which just placed a more severe punishment on the illegal sale and the illegal use of steroids. So the two major types of steroids are anabolic and corticosteroids. And the anabolic steroids are manufactured performance-enhancing drugs that produce the same effects as the male hormone testosterone. The anabolic steroids aren't typically used for medical use, but rather by athletes, powerlifters, and bodybuilders. The anabolic steroids are used to gain weight by producing a higher amount of muscle mass, and they can be taken orally as pills or injection by needles. The corticosteroids are also known as systemic steroids, and they are mainly used for medical reasons such as relieving and treating inflammation, like rheumatoid arthritis and even lupus. There are 4 types of corticosteroids that are used, but the two main ones are dexamethasone, which is used in urgent treatments such as like swelling in the brain or brain tumors. The other one is hydrocortisone, which relieves inflammation in tendons. And although both steroids are used frequently, I'm going to focus more on the anabolic steroid just because it's more prevalent in today's society. So I just discussed the history of steroids and the two major types, and next I'm going to talk about the potential effects of anabolic steroids and what they can do to your body. And obviously you have different systems in your body and they all react differently, so when you add all those reactions together, you can have a plethora of issues. The National Institute of Drug Abuse claims that anabolic steroid use can be associated with a wide range of adverse side effects that include mental and physical risks. The possible hormonal health consequences of steroid use in men include infertility, shrinking of the testicles, male pattern baldness, and even breast development. And in women, it's mainly just excessive hair growth and male pattern baldness. The effects of steroids on the musculoskeletal system include a short stature if their steroids are taken by adolescents, and even tendon rupture. There's also an increased risk of high blood pressure, heart attack, and then enlargement of the heart's left ventricle. The liver can also be taken over by tumors and cancers. When you take steroids, the skin generally generates more acne and oil, and even can develop jaundice, which is yellowing of the skin, and your skin typically retains more fluid. And then obviously there's more than just the physical health risks, there's also psychiatric health risks, and they can include rage, aggression, mania, and delusions even. And although these side effects are only potential and most are linked to the long-term effect of steroid use and steroid abuse, it's important to always be conscious of them, especially if you're going to be taking steroids. So lastly, I just wanted to discuss the possible health benefits that a person can get by using anabolic steroids. The anabolic steroid increases the amount of testosterone in the body, which can produce a positive outcome by increasing muscle mass, repairing tissue faster, and then increase of endurance and even fat loss. So the anabolic steroid can also improve bone density, meaning it can be used to treat conditions like osteoporosis, which is when your body can't produce enough bone or loses too much bone, or both combined. And then lastly, they can also improve drive and ambition, because the steroid primarily focuses on the alpha male traits. So if a man is lacking in testosterone, he can take a steroid and generally become more of a man, so to say. So I've discussed the history of steroids, the negative health consequences, and also the benefits of the anabolic steroid. And it's clear that steroid usage today is like super prevalent, and it's not going away, and there's always a demand for anabolic steroids. So just knowing the risks and the benefits of the steroids, especially if you plan to use them, like I've stated before, is extremely important. And I always recommend checking with your doctor and finding alternative options if you are having issues like that. So yeah, all right, thanks for watching.